Upper airway ultrasound. Anyone use it before? Perfect. Okay. What is the indication? An emergency. An emergency. Perfect. In difficult airway, right? Cricothyroidotomy. In surgery during percutaneous tracheostomy. Perfect. To exclude vocal cord paralysis. Right? But in the emergency setting, the first is cricothyroidotomy. Again, anatomy. The pharynx is divided into nasopharynx, oropharynx at the level of the larynx, and this is our scope. Starting from hyoid bone, then thyrohyoid membrane, thyroid cartilage, بعد كده cricothyroid وcricoid cartilage, then trachea rings. Indications, as you said, cricothyroidotomy, percutaneous tracheostomy, identification of endotracheal tube in a placement, a false place or false track intubated in esophagus, yeah, and identification of vocal cord palsy. Technique, the patient is in supine sniffing position to open the view using high frequency linear probe, superficial probe in two planes, horizontal and vertical. In vertical scanning, marker is directed up, starting from suprasternal notch, seeing the trachea rings like beads, then cricoid cartilage, then a membrane, cricothyroid membrane, then thyroid cartilage. This is our aim, demonstrating cricothyroid membrane to insert a needle and save live. Sorry? Again. Beads, trachea. Cricoid cartilage, line, this hyperechoic line. Yes, membrane, then thyroid cartilage. Here is the place of insertion. No, hypoechoic. At the level of cricothyroid membrane, hypoechoic structure between the cricoid cartilage and thyroid cartilage, this line. For urgent surgical airway cricothyroidotomy. Trachea rings. At the end, I will revise again. Okay. Trachea rings, as I said, beads, and this is in surgery for percutaneous tracheostomy. Changes the best position to insert tracheostomy tube. Yes, exactly. In transverse view, thyroid cartilage level, at this level, vocal cords can be seen as a hypoechoic structures and demonstrate if there is paralysis or not. When I ask patient to say a sentence, say his name, and say the vibration action of the vocal cords moving. This is thyroid cartilage, and this is hypoechoic vocal cords. I think there is a video not working. Cricothyroid cartilage level, at this level, looks like hypoechoic inverted U-shaped structure placed inferior just below the thyroid cartilage, and at this window take transverse measurements to select size of endotracheal tube. Size of endotracheal tube by measuring the diameter. Transverse trachea rings. as you're going up. Sinus, thyroid gland, loops, and the isthmus. This is important part during tracheostomy in order to avoid, yes, injury. Thyroid, cricothyroid cartilage, line, reverberation artifacts. Thyroid cartilage, vocal cords. الحركة اللي كانت بتتكلم فتحرك الفوكال كوردز moving vocal cords. Correction of endotracheal tube placement by transverse imaging at the level of cricoid cartilage. Successful endotracheal intubation confirmed by the presence of artifact. Do you remember yesterday physics lecture? Yes. This is trachea rings. No airway column. Outside. Air column. This is better image. This is endotracheal tube in place in trachea. Trachea rings, then tube of air. While here, beside, to the left. Sorry again. This video will show you more. Artery. Air column. That normally not present here. The esophagus is a collapsed organ. Yes, the left. Yes. Transverse. To the left. Now as this video there is false endotracheal tube placed in esophagus. Assuming this is not appearing right here. This air column in a wrong position. Instead to be here at the site of trachea rings. So if you saw an air column with, this is an artifact with reverberation. This is wrong place. You can predict post-extubation stridor due to presence of edema. Ultrasound is a safe and repeatable, easy to perform and easy to learn bedside technique to do cricothyroidotomy, tracheostomy, or endotracheal tube placement. If wrong in esophagus, you can change to trachea. And thank you. Break. بعد الصلاة إن شاء الله. We'll back to do ocular ultrasound و upper airway إن شاء الله.